Welcome back to our Health and Wellness channel. We're glad you've joined us today. As we journey together through the fascinating world of health, we often stumble upon intriguing topics that may be the missing piece in our puzzle of wellness. One such topic is thyroid disorders, a condition that affects millions of people worldwide, often in ways that are subtle and easily overlooked. The thyroid, a small butterfly-shaped gland located in the neck, plays a vital role in our body. It produces hormones that regulate our metabolism, affecting everything from our heart rate to our body temperature. But what happens when this tiny powerhouse doesn't function as it should? The effects can be far-reaching, and sometimes quite mysterious. Today, we'll be discussing 10 hidden symptoms of thyroid disorders. This might be the key to unlocking the mystery of your health concerns. The first hidden symptom of a thyroid disorder is a change in your menstrual cycle. The thyroid gland, a small butterfly-shaped organ located at the base of your neck, plays a significant role in regulating your body's metabolism. When this organ is not functioning correctly, it can disrupt your menstrual cycle. Women with thyroid disorders often experience irregular periods. These can be heavier than usual, known as menorrhagia, or they could be lighter and shorter, or longer than typical cycles. This irregularity is often associated with hypothyroidism, a condition where the thyroid gland does not produce enough hormones. But the thyroid's influence doesn't stop at your menstrual cycle. Another hidden symptom to watch out for is changes in your hair texture. The health of your hair is closely tied to your overall well-being, and your thyroid gland plays a crucial role in this. When your thyroid is out of balance, it can lead to changes in your hair's texture and growth pattern. You may notice your hair becoming thinner, drier, and more brittle. In some cases, this can even lead to hair loss, not just on your scalp, but also on other parts of your body like your eyebrows. These changes are often subtle and gradual, so it's easy to dismiss them as merely a result of aging or stress. But if you're noticing a significant shift in your hair's health and texture, it could be a sign of a thyroid disorder. Remember, these symptoms on their own are not definitive proof of a thyroid disorder. They could be caused by a variety of other health conditions. However, if you're experiencing these symptoms persistently and in combination, it's worth discussing them with your healthcare provider. A simple blood test can help identify if your thyroid gland is functioning as it should be. So, irregular menstrual cycles and changes in hair texture might be more than just a nuisance. They could be signs of a thyroid disorder. Keep in mind, early detection and appropriate treatment can effectively manage thyroid disorders, so don't hesitate to seek help if you notice these changes. Moving on, the third and fourth hidden symptoms are changes in bowel habits and appetite. Now, we are not talking about occasional constipation or a skipped meal. We are referring to persistent, noticeable changes that may be linked to thyroid disorders. Let's start with bowel habits. Hypothyroidism or low thyroid function often slows down the body's metabolic processes, including digestion. This can result in constipation or difficulty emptying the bowels. On the other hand, hyperthyroidism, where the thyroid is overly active, speeds up these processes, leading to the opposite problem: diarrhea or more frequent bowel movements. It's easy to dismiss these symptoms, attributing them to a bad meal or a stressful day. But if you notice a consistent pattern, it's worth considering that your thyroid might be playing a role. Now let's talk about appetite. Thyroid disorders can significantly impact your hunger cues and metabolism, leading to changes in weight. Hyperthyroidism often stirs up an increased appetite. Despite eating more, you may find yourself losing weight because your body is burning up calories at a faster rate. On the flip side, hypothyroidism can dampen your appetite. You may not feel like eating much, but still notice weight gain because your body's metabolism has slowed down. It's important to note that these symptoms can be subtle and can easily be attributed to lifestyle factors like stress or diet. However, when these changes in bowel habits or appetite persist, or are accompanied by other symptoms like fatigue or changes in mood, it's a good idea to seek medical advice. Thyroid disorders are more common than you may think, and they are usually manageable with the right treatment. So if you notice these changes, it doesn't necessarily mean you have a serious illness, but it does mean you should pay attention and possibly consult a healthcare professional. Always remember, persistent changes in your bowel habits or appetite could be a sign of a thyroid disorder. Joint and muscle pain and changes in mood are also symptoms to watch out for. Thyroid disorders can have a profound impact on your body's musculoskeletal system. Unexplained joint and muscle pain, stiffness, or weakness might not immediately make you think of your thyroid, but these can be significant indicators of a thyroid disorder. This kind of discomfort might be mistaken for other conditions like arthritis or fibromyalgia. But if you're feeling these aches and pains without an apparent cause, it may well be time to consider the health of your thyroid. But it's not just the physical symptoms to be aware of. The thyroid also plays a substantial role in your mental well-being. Changes in mood, such as mood swings, anxiety, irritability, or depression, can also be symptoms of a thyroid disorder. Especially in cases of hyperthyroidism, where the thyroid gland is overactive, these emotional symptoms can be quite prominent. Yet, they can be subtle, sneaking up on you in ways that you might not immediately connect to your thyroid. It's easy to misattribute these mood changes to stress or other life circumstances. However, if you find yourself experiencing mood swings that seem out of character, or if anxiety or depression becomes a constant companion without an identifiable cause, it's worth considering that your thyroid could be playing a part. Like with any symptom, it's important not to jump to conclusions. These symptoms, both physical and emotional, can be caused by a multitude of different factors. However, if they persist, particularly if they occur together or alongside other symptoms we've discussed, it would be prudent to seek advice from a healthcare professional. Remember, your body is a complex mechanism, and every part has its role to play. The thyroid, small as it may be, has a big job. So it's crucial to listen to your body and take note when things don't feel quite right. If you're experiencing unexplained joint and muscle pain or mood swings, it might be time to check your thyroid. Skin changes and cholesterol levels can also indicate a thyroid disorder. Our skin is a visual health barometer. Changes in its appearance often signal that something's not quite right inside our body. The same applies to our cholesterol levels, which can be indicative of underlying health issues, including thyroid disorders. Now let's dive into how thyroid disorders can affect skin appearance. When your thyroid is underactive, a condition known as hypothyroidism, it may cause your skin to become dry and rough in some cases, even leading to a pale or yellowish complexion. You might also experience thickening or thinning of the skin. Conversely, an overactive thyroid, or hyperthyroidism, could result in warm, moist, and itchy skin. These changes occur because thyroid hormones play a crucial role in skin cell renewal. When those hormones are out of balance, it disrupts the skin's natural processes, leading to noticeable changes in texture and appearance. In addition to skin changes, thyroid disorders can also affect your cholesterol levels. The thyroid produces hormones that control how your body uses energy. When it's underactive, it can slow your metabolism, leading to elevated levels of low-density lipoprotein, or LDL, often referred to as the bad cholesterol. High levels of LDL cholesterol can increase the risk of heart disease. On the other hand, an overactive thyroid often leads to lower cholesterol levels. However, lower cholesterol isn't always a good thing, as it could indicate your body is burning energy too quickly, which can strain your heart and other organs. Routine cholesterol screenings can be an effective way to detect underlying thyroid issues. If you have high cholesterol levels and lifestyle changes or medications aren't making a significant difference, it could be worth discussing the possibility of a thyroid disorder with your healthcare provider. Remember, your skin and your cholesterol levels are just two of the many aspects of your health that your thyroid influences. So if you're noticing changes in your skin or cholesterol levels, your thyroid could be the culprit. The key is to stay vigilant, understand the signs, and seek medical advice when something feels off. Lastly, changes in heart rate and body temperature regulation are also symptoms of thyroid disorders. The thyroid gland produces hormones that play a crucial role in regulating the heartbeat. When these hormones are out of balance due to a thyroid disorder, it can lead to an abnormal heart rate. Hyperthyroidism, where the thyroid is overactive, often causes a rapid or irregular heartbeat known as palpitations. Hypothyroidism, on the other hand, where the thyroid is underactive, might lead to a slower than normal heart rate. As for body temperature regulation, it's the thyroid hormones again that are in charge. They help maintain the body's basal metabolic rate, which affects how much heat the body produces. Thus, an overactive thyroid might make you feel constantly warm or cause excessive sweating, while an underactive thyroid can make you feel cold all the time. Increased heart rate or difficulty regulating body temperature could be a sign of thyroid dysfunction. We've covered a lot today, and we hope you found this information helpful. Let's quickly recap. We've unveiled the 10 hidden symptoms of thyroid disorders. These include changes in menstrual cycles, hair texture, bowel habits, appetite, and even mood swings. You might also experience joint and muscle pain, alterations in skin appearance, cholesterol levels, heart rate, and body temperature regulation. These symptoms can often be elusive, masquerading as other health conditions, making thyroid disorders tricky to diagnose. It's crucial to remember that if you're experiencing persistent or multiple symptoms, It's time to consult a healthcare professional. Early detection and appropriate treatment can effectively manage these disorders, ensuring you lead a healthy and active life. Thank you for spending time with us today. If this is your first time here, please take a second to subscribe, share our content with friends and family, and remember to click the notification bell to stay updated on our latest videos.